I'm Peter Bookman, Global Strategist for Sphere 3D. I'm here with Mark Watts, Vice President of IS for NovaRad. Thanks for being here.
Thanks, Peter. I appreciate being here too.
So I wanted to start off with, how did you end up at NovaRad?
This opportunity presented itself after a successful run at Community Health Systems in Franklin, Tennessee, in which I oversaw the largest civilian deployment of a VNA in the United States, over 1 billion images brought in from 130 hospitals. Wow. Yeah.
So you mentioned VNA. Can you explain what that means?
A vendor-neutral archive in which we can actually ingest any format of visual data into a centralized archive and then present that through a universal viewer. What it does essentially is take care of that 1/3 of medical information that's not represented by the EHR at this time, and it really gets a complete record of the patient for treatment.
How does NovaRad take a different approach to healthcare IT?
We have a different business model altogether, and that is that all of our products are evergreen, meaning that if you're a customer of ours, you get the continuum of improvement that we strive for at NovaRad. So a large percentage of the people who work for us are engineers, and we're owned by Dr. Wendell Gibby, and he's always perfecting our product and trying to do a little bit more with it. And our customers really are the beneficiary of that effort. The challenge comes when the software exceeds the capability of our legacy hardware. And this is where a product such as yours comes into play. It allows us to add that resource that's necessary for us to maximize the effort within the software.
What do you see Glassware doing now as well as in the future?
Right. I'm excited about the opportunity to have any application on any platform, on any glass. And what that means is it removes it increases the data liquidity, quite honestly, between an outpatient environment and an inpatient environment and a physician's group. It improves the communication between the physician and the patients themselves. This opens up, as a platform, it presents itself as an opportunity for there to be patient engagement at the next level.
Wonderful. Virtualization of applications isn't new. How would you explain the difference between virtualization of applications and containerization of applications like what Glassware does?
It's really about the ease of deployment and the ease of maintenance. It's a solution that is literally a plug and play. And I hate to say that, but the truth of the matter is I've seen deployments actually go live in 6 hours. I've seen the virtualization of software that I thought personally was a moonshot, was something that would be very difficult for them to execute on, and have been extremely satisfied with the results.
What is the role of the desktop in healthcare IT?
It's important that the data follow the physician, and the physician has obligations within the walls of the hospital, in their physician office, and they actually do quite a bit of work at home. So for them to have a standardized format and availability to that data in a secure manner, it means the world to them, because they can actually go home, have dinner with their family, put their kids to bed, and complete tasks after hours that they know are necessary. So to have a unified presence, regardless of which piece of glass they're looking at, it really does help their productivity.
That is awesome. What do VDI and containerization of applications technologies accomplish together?
So it's really the secure presentation of the data. Medical information is actually 10 times more valuable than a credit card information. The credit card industry has taken extreme steps forward to address the fraud, whereas the healthcare industry is lagging behind as far as that is concerned. Now, virtualizing these products and making them available in a container that can be presented in a secure manner would prevent that loss of data and HIPAA violations.
Extending this further, how does this apply to more mobile devices and more mobile environments?
I think that with the healthcare right now in the United States hitting 16% of the GDP, that there's a concentrated effort on becoming more efficient. And some of those new and available technologies, such as telemedicine or telepresence, or engagement of the patient so that they treat themselves better over time. In particular, I think that the iPhone or an interaction like that is going to become more meaningful to the physician and the patient. That we are going to actually have a bilateral dialogue that is continuing. In fact, Medicare is starting to pay for chronic care. So if a patient has a chronic condition,
Yep.
they are paying them a monthly stipend per patient to maintain their wellness, which is a completely different approach than the episodic events that traditionally have been healthcare. And so this is the opportunity to have the information at your fingertips, the opportunity for them to help maintain this patient long term are going to be accentuated by the access to this data. Well, the interesting thing about this is the deployment is infinitely simple. It is as simple as downloading any kind of application off of the iPhone store, and that becomes your deployment system. You say to a physician, go here, pull this down, it's on your desktop, you could log in, you're functional, and you're up and ready. So the ease of deployment is unbelievable, in my opinion. In healthcare, was reliant on SneakerNet for the longest time, and I was concerned about whether a desktop was locked down or whether I could ingest this information into it. And so I had to pay a lot of man hours for people to go out to a site and help them maintain it. But now it's as easy as downloading any application you would want off of the iPhone.
What is the absolute coolest thing you've ever seen?
There are certain things that I'm so excited about in healthcare, and one of them is the inclusion of genetic information into an EMR, and the ability to process those data sets, I think, are going to be advanced by the flexibility that VDI brings to the table. And I think that there is some unhappiness right now with the EMR solutions that are out there, and I think there's going to be a phase 2, and I think that phase 2 is going to be created on the platform that is virtualized to go forward for deployment and for maybe even development. So I really think that this is a transformative platform that we're talking about, and that for us to accelerate the wins, to accelerate the distribution of best practices, to really push a whole organization forward, you need to have a platform like this that readily distributes the good content.
How do you tell the difference between virtual desktop stuff and containerized application stuff like the V3 and Glassware or any of the other solutions out there?
Well, Glassware is meant to support an application, right? And the VDI supports multiple applications on the desktop. There are applications for both sides, and they're extremely valuable. If you want to isolate a certain application that no longer is supported by the vendor, or that is on maybe a questionable bit of hardware that you can't get it off of, that's when the containerization has tremendous value from a security perspective. The distribution of an EMR, a billing, a scheduling, and all of the other things that we take as far as applications on a day-to-day manner in healthcare, for it to be put onto one single pane of glass, and it's not dependent on whether it's got a thick client underneath there or not, but is easily deployed, allows you to go into this mergers and acquisition phase that healthcare is in right now, quite honestly. Hospitals are buying physician practices, so on Friday it's owned by these guys, on Monday it's owned by these guys. How do you make sure that your IT infrastructure is deployed in that kind of weekend segment? And I really think that VDI distribution is the way to go on that. As long as I get value out of this proposition, I have ran 190 MRI units without knowing how an MRI unit. I've never been an MRI tech. I could not sit down in those chairs and make them work. And yet I don't need to know that. I need to know the rules as far as payments are concerned. I need to know the safety rules that are associated with it. I need to know how to hire the right people so that they can do that kind of work. But at the end of the day, I don't need to know why the technology works. I just need to know how to apply it in real world circumstances.
What's on the top of your bucket list?
Well, I would really like to run with the Bulls in Spain.
I was hoping for that answer.
Yeah, that would be a big thrill for me. I think that's going to happen. I love to travel. I've been to Spain before, and I think that one's a short putt in my opinion.
Let's go do it.
I look forward to it.
Thanks, Mark. Appreciate it.
Thank you, Peter.